We're all very comfortable talking to each other about the weather. It's very cold outside, it's very hot outside, but we don't want to talk about kind of this long-term driver of why we have the weather that we do. And science is kind of like our Google Maps when we're driving for climate change. If we're able to get in our car and follow our GPS to our location, it might tell us that road is closed. Maybe divert and go a different direction. Here's an alternative strategy. And that's the kind of information that climate science is giving us. It's giving us the ability to prepare, to adapt, and to get places safely going forward. Funding cuts to climate change research can impact people in unexpected ways. Obviously, we'll have less of an understanding of how factors like wildfires or tropical cyclones or huge windstorms might impact our health and what sort of outcomes to expect. It also can be linked to things like reduced treatment for people with chronic illness, where their illness might be exacerbated by climate-related exposures. For example, cancer patients undergoing chemotherapy. If there are really high temperature exposures while that's happening, it might mean the treatment doesn't work as well. My lab has done a lot of work trying to understand how wildfires impact our health, both immediately when we inhale smoke and then over a longer term period. Some of our work, for example, has looked at short-term exposures to wildfire smoke and people seeking care for respiratory illness in the following days. We've seen that when there's more smoke, we do see more of those respiratory visits. Something we found in California is that communities with more air conditioning are much more protected from the impacts of smoke. Another project we've worked on is related to the January 2025 Los Angeles wildfires. This was a really tragic and unprecedented event in an urban setting in the US, and something we're expected to see more of under climate change. And so we really wanted to understand as quickly as possible what were the population health impacts. Through NIH-funded research, have been able to work with collaborators in Los Angeles at Kaiser Permanente Southern California, use electronic health record data, and we've already been able to see just a few months later, big increases in care seeking for respiratory outcomes, cardiovascular disease outcomes, neuropsychiatric outcomes, and injury-related outcomes. Kaiser patients were really utilizing virtual care in a way that hasn't been noted before. And this is an important finding for all climate-related disasters.